Venous return. Venous return basically means taking blood from the veins and returning it to the heart. Now, this is not as straightforward as you might think. There are two major challenges we have to overcome. Number one is gravity. If you think about like a person, right? The heart is located right here, and what's going to happen is all the blood below this point has to move upwards against gravity in order to return to the heart. So that presents some challenges. And the second problem is low pressure. You might remember from our discussion on capillary exchange, the farther away you are from the heart, the lower the blood pressure. So by the time you are in the veins, the pressure is quite low. And fluid, which is basically what blood is not going to be able to move very fast if the pressure is low. I mean, you can kind of think about this. If you water your lawn and you don't turn on the tap to the fullest, right? Then the water is just going to be kind of dripping out as opposed to be shooting out at the end. So low pressure will cause fluid to slow down. So we must come up with a way to deal with this. To fix this problem, we use what's called a skeletal muscle pump, which will help circulate the blood. So it turns out every time you walk around, then your muscle, the muscle in the calf, for example, is going to serve as a pump to squeeze on the veins. And that squeezing will allow the blood to go upwards. Okay, so it doesn't really go all the way back to the heart, but it will move up a little bit. And then when you relax your muscle, then the blood will fall back down. So in order to catch the blood and not let the blood go all the way back to the feet, for example, in the veins you have these valves that would open whenever the muscle contracts to allow the blood to go through, but as soon as the muscle relaxes, they will close and catch the blood as they fall back down. So, slowly but surely, every time you contract, the blood is going to be able to move up a little bit and get closer to the heart. So, I don't know if you had this experience, but sometimes if you are on a really long flight, for example, and then you decided to take off your shoes, and you might fall asleep, and at the end of a 12-hour flight or something, you might not be able to fit in your shoes. What happened is when you're falling asleep and you're not moving your legs around, combine that with the high altitude, what happens is all this blood is basically pooling in the legs, and you're not circulating them back to the heart. And as a result, if you look at the capillaries in the legs, because now you have more blood, so the blood pressure is going to increase, and from 30 mmHg to, I don't know, like 35 or something. These are just hypothetical numbers, and so the osmotic pressure is the same. So as a result, you would have more fluid loss than you otherwise would, and those extra fluid will be accumulating in the tissue, causing your legs to your feet to swell up, and you're not going to be able to fit in your shoes anymore. This is quite an important mechanism in terms of returning blood to the heart. There are some conditions called varicose veins, and that happens when the valves are damaged. So without the valves, the blood will not be able to get back to the heart as efficiently as it would. Because remember, right? Every time you pump up, as soon as you relax your muscle, the blood is going to come back down. And if you don't catch those blood, it's going to go all the way back down to where it was, as if they never got anywhere. So over time, you have this fluid accumulation problem, and that shows up as these bulging in the affected veins. So sometimes people would have to wear like a elastic stocking, and that elasticity in the stocking will help circulate the blood to simulate that action of the skeletal muscle pump and help bring it back to the body. Pregnant women can also have some of these varicose veins. It kind of happened to my wife in her second pregnancy because of the extra weight right of the baby, and that could prevent the fluid from going back to the heart efficiently, and so they start to pull a little bit in the legs. Blood pressure. Blood pressure, as we mentioned earlier, is the pressure that is exerted by blood against the wall of the vessels that it encloses it. Basically, if you think about like a blood vessel, we are talking about how much force the blood is pushing onto the blood vessel, right? Same thing as a balloon, right? If you think about a balloon, you blow air into it, right? The air would apply a pressure on the walls of the balloon, right? So it's the exact same concept, except we're talking about a liquid here as opposed to gas, but they're both fluids, right? So the blood pressure is as a result of the force exerted by ventricular contraction. Basically, when the ventricle contracts, that adds the pressure to the blood, and that's going to be felt throughout your entire vascular system. So also, as mentioned before, the blood pressure will decline as it proceeds through the systemic or pulmonary circuit, and depending on whether the heart is contracting or relaxing, the blood pressure will be different, right? So if you measure the blood pressure when the ventricles are contracting, that number is going to be higher, and we call that the systolic pressure. And if you measure the blood pressure when the ventricles are relaxing, then it's going to be lower, and we call that the diastolic pressure. So if you ever have your blood pressure taken, at one of those Shoppers Drug Mart machines thing, usually they would tell you that the good number would be 120 mmHg for systolic pressure, over 80 mmHg for diastolic pressure. The blood pressure is going to be dependent on various factors, and here are 3 factors that could affect your blood pressure. First is the total blood volume. So basically, in general, the more blood you have, so higher blood volume, that would translate to higher blood pressure. Right? So if someone is suffering from hypertension, from high blood pressure, one of the things that the doctors can do is they can give you these things called diuretics, or sometimes called water pills, and they basically make you pee more. So by going to pee more often, you are basically decreasing your blood volume, and as a result, you can bring your blood pressure down. Next, we have stroke volume. So stroke volume is basically how much blood your ventricles ejects per squeeze, per contraction. So the higher the stroke volume, that would translate to higher blood pressure as well. So higher SV equals to higher BP. Vessel diameter. The blood vessels are surrounded by smooth muscles, and so they could change the diameter. It's regulated by your nervous system. So there are two possible options, right? We can have just put down here actually, vasoconstriction. That means you are going to have reduced diameter. Okay, reduced diameter. That's when your blood vessels is gonna get smaller, right? So that is going to equal to higher blood pressure, right? Think about squeezing a balloon. Right? You squeeze the balloon, the pressure is going to go up inside. The opposite of that is vasodilation. Vasodilation, which is when the blood vessels get bigger, so you will have an increase in diameter, which would translate to a reduced blood pressure. Okay, so these are different factors that could affect your blood pressure, and as I mentioned, you are going to be measuring the blood pressure in 2 numbers, systolic and diastolic, and these numbers are typically associated with what normal blood pressure is. But I mean, these numbers are not universal. It really depends on the person. For someone who is older, then maybe these are not realistic numbers. For someone who suffers from a heart attack, then again, these numbers might not be realistic. So everybody needs to have like a baseline pressure, blood pressure to compare to know whether or not the readings are normal or abnormal for that individual. So here is a graph that shows you the relationship between blood pressure and the distance from the ventricles, and you can see as we talked about multiple times already, the farther away you are from the heart, the lower the blood pressure. So you can see initially at the aorta, which is again directly connected to the heart, right? The blood pressure is going to fluctuate between 120 and 80, depending on whether the ventricles are contracting or if it's relaxed. And what happens is you can see that fluctuation actually decreases the farther away you are from the heart. And by the time you get to the capillaries, the pressure becomes the same. That means if you were to measure the blood pressure in these vessels, it would be the same number regardless of whether the heart is contracting or not. This graph has two pieces of information on it. There is velocity. Velocity basically means the speed of blood flow, and there's something called total cross-sectional area. So let's focus on the velocity aspect here first. So velocity, or the speed of blood flow, is actually dependent on two factors. So number one, it depends on blood pressure. Right? So generally speaking, if you have higher blood pressure, then is going to have a higher speed. Right? That should be quite straightforward. Number two, it depends on the vessel diameter. Okay, diameter. So if we were just to look at diameter on its own, if we were to just look at the effects of diameter on the speed of blood flow alone, then increase in diameter would equals to increase speed. Right? Think about like a highway, right? If a highway has like 6 lanes, then the traffic is going to go faster as opposed to like 2 lanes, right? Now this might be a little bit confusing because, you know, just a couple slides ago I was telling you if the diameter of the vessel is bigger, then your blood pressure is going to go down, right? So you know your speed should be reducing, which is why I said, right, let's look at these things separately, right? If they are just on their own, right, then blood pressure would increase speed, and if we just look at diameter without thinking about blood pressure, then increasing diameter is going to increase the speed, right? Just like the highway analogy that I gave you. So you know, putting them together, then we would see that in the arteries and the aortas, you will see velocity is quite high, and it's going to be fluctuating, right? Because blood pressure is fluctuating in the beginning part, right? Just like the previous graph shows, right? So you would expect the velocity to fluctuate, to be speeding up when the heart is contracting, and to be, you know, a little bit slower when the heart is relaxing. But at the capillaries, the velocity is going to be the slowest, right? You want to slow down the blood flow significantly so that you are going to have time to do gas exchange, right? So slow down for gas exchange. If the blood is going through the capillaries really quickly, then you don't have time to allow the diffusion to occur. Once you finish with the exchange, the speed is going to pick up a little bit again at the venules. So the blood pressure is the lowest at the veins, but the velocity, the speed, is the lowest at the capillaries. The third graph here, right? Let me just erase all these things, make it less clutter. The third thing that is being shown here in the graph is the total cross-sectional area. So that basically what that means is if you were to lay out all the blood vessels, which one would cover the most area, right? So it turns out capillary will cover the most area. The capillaries would have the highest total cross-sectional area. No cell in the body is more than 2 cells away from a capillary vessel. Okay? That's because that's the distance that's required for adequate oxygen gas exchange distribution. So for that reason, you have a lot of capillaries. So individually, the capillaries are small, but you have a lot of it. Aorta is really big, but you only have one of them. So as a result, the total cross-sectional area is not too great for that. So hypertension is basically high blood pressure, and that is the inability to regulate blood pressure. Your body has various built-in mechanisms to maintain normal blood pressure, to maintain homeostasis. We're going to be looking at some of these mechanisms in the kidney units, for example. So if those mechanisms fail, or even your kidneys try to compensate, other mechanisms try to compensate, you're still not going to be able to bring down the blood pressure, then you are going to have hypertension. Okay, so if the resting blood pressure is above this number, then typically we say the person has high blood pressure. Resting means you're sitting there, you're not running around doing exercise, right? You're just calm sitting there, and they take your blood pressure. And if it's above this number, then you have high blood pressure. So high blood pressure is not too good for your heart and your kidneys. They make them work harder, and actually it will increase the risk of getting heart diseases and kidney failure. Some of it is hereditary. Some of it is diet. And if you have high blood pressure, you probably should avoid things like that are too salty, right? So, for example, if you have high sodium, right, you take a lot of salty food. Eventually, all that sodium might end up in your blood vessels, right? So, if you think about the capillaries exchange concept we talked about before, now you have much more dots here, right? So all that extra dots is going to cause you to draw more fluid into your blood vessel, right? So increase in sodium can lead to increase in osmotic pressure, and that could result in increase in blood volume, right? And as we mentioned earlier, if you have more blood volume, that could increase your blood pressure. Okay, so that's why people say, if you have high blood pressure, then maybe cut down on the sodium. So more concept check questions, please try them out first before you look at the answers. Blood pressure is typically the lowest in veins, right? The farther away you are from the heart, the lower the blood pressure. Velocity of blood flow is typically lowest in capillaries because you want to slow down significantly to allow gas exchange to occur. Velocity of blood flow is higher in a blood vessel that has, so remember, velocity of blood flow depends on two factors, depends on blood pressure and diameter. So for blood pressure, the higher the blood pressure, the faster it is. So I want something to be very high in pressure if I want the blood flow to be higher. So there's high pressure here. And for diameter, the bigger the diameter, the faster it's going to go, right? Just like more lanes in the highway, the faster the car is going to be. So I want something with large diameter. Okay, so the answer is C. So please take a moment and try to fill in this chart. These talks about the different characteristics of the arteries and veins. Higher blood pressure is artery because it's closer to the heart. Thicker vessel wall, that would be artery as well, because in order to withstand the high pressure in the artery, you want the walls to be thicker, right? Otherwise, they would rupture easily. Larger lumen diameter, that means in terms of the vessel diameter, which one is going to be bigger? That's going to be the veins. Just gotta quickly go back to a few slides earlier, right? Over here, you can see this is artery, this is vein, right? You can see the vein is much larger in terms of the lumen, right? And you can see the walls of the artery is thicker, right, to withstand the pressure. So back to the chart over here. Contains valves, right? So the veins contains valves. It's part of the mechanism to help with the venous return, so you can trap the blood as they fall back down when your muscle relaxes. Blood has higher velocity in artery and carries blood away from the heart. That is artery as well. Now we're gonna talk about some cardiovascular diseases. Now, cholesterol, and a lot of people know that cholesterols are not too good for the heart. I mean, we need cholesterol to function, right? A lot of our cell membranes, for example, we need cholesterol in there, and we use cholesterol to make hormones, right, like testosterone and estrogen. So cholesterol is not all bad. Okay, some of it is required for life, but if you have excess, then the cholesterol might build up, and that could cause some problem. So there are two types of cholesterol, the LDL and the HDL. Right? Cholesterol is typically absorbed in your digestive system, and then they would get processed in the liver. Right? The liver would combine the cholesterol with something called the lipoproteins. So it could create something called low density lipoproteins, or LDL, and then it could create something called high density lipoproteins. So basically, the LDLs are the bad ones here, right? It will cause a buildup of lipid in the arteries, and over time it could cause it to become narrow. So this is your artery, and then you got some fatty stuff building up here with the LDL, and then this just keeps on getting bigger and bigger, and then eventually you will have a narrowing of the blood vessel, or stenosis, as we learned the proper name earlier in the lecture. So atherosclerosis is the hardening of the artery, right? So this is something that could happen when there is a substantial buildup of fatty materials in the arterial wall. So you might remember I mentioned this earlier in the lecture. The surface that blood comes in contact with should be a smooth surface. Anytime you have a surface that's kind of having like a rough patch, then that is going to encourage the formation of blood clots. So this is exactly what happens. If you have a little bit of lipid buildup here, right, because of the LDL, then your blood cells are not going to like that, and then it's going to start to form a clot on top of this, and then that will lead to more clots and more clots. So once you have that initial start, then that kind of results in like a snowball effect that will eventually cause your vessel to become very, very narrow. And depending on where this happens, it could have different results. So here in this picture, we can see on the left side, this is a normal blood vessels, and you can see the lumen. Lumen means inside, right? Lumen. The lumen is unobstructed, and on the right side here, you can see this pinkish thing here. That's the atherosclerotic plaque. That's the fatty substance that was building up initially, and then what made it worse is the blood clot, right? Because of a rough surface here, the blood is going to stick to it, and eventually you have a very, very narrowed lumen. Now, just to recap some of the stuff we learned earlier, the heart cannot use the blood that is inside its own chambers because it's very high blood pressure. You cannot do gas exchange if the pressure is really high. The diffusion would just not work. So they rely on a separate network of blood vessels called the coronary arteries to supply the heart muscle with oxygen. So in this picture, you can see the heart muscles are all dissolved away, and you can see the extensive network of coronary arteries. So these are very vital blood vessels. We don't want them to clot. If you clog them, then you are not going to be able to supply the heart muscle with oxygen, and that is bad news. So if the coronary arteries are damaged or are blocked because of the buildup of fatty materials or because of atherosclerosis, then it could lead to a whole group of conditions called a coronary artery disease, or a CAD. So you can have a partially blocked coronary artery, or you can have completely blocked coronary artery. So of course, the partially blocked is not as bad as the completely blocked. So in this case, the person might experience angina. Angina basically means chest pain, right? So if a person has a narrow, partially blocked coronary artery, then if they walked up a flight of stairs, right, they might experience shortness of breath, and then they would experience angina because walking up a flight of stairs requires the heart muscle to deliver more oxygen, and if you have a narrow coronary arteries, you're not going to be able to do that. So people with angina, they sometimes would be taking aspirin. Aspirin can act as a blood thinner, and if your blood is thinner, it's able to flow through the gaps a little bit easier. But of course, if your blood is thinner, that would also mean that they would take longer to clot. So that could be a problem if you injure yourself. People also can take what's called nitroglycerin. So nitroglycerin, you might have heard of it as an explosive, and that's actually true. It can be an explosive, but this is pharmaceutical grade nitroglycerin, and it's a pill that can be taken. Sometimes people can do nitroglycerin spray as well, or they could keep the pill under the tongue, and that would help open up the blood vessel. So these are basically vasodilators. That would then allow the blood to flow, to be restored temporarily and to flow again. So these are not permanent solutions, right, for partially blocked coronary arteries. But they are kind of like things that we can do to minimize the symptoms. To kind of fix the problem, then the person might consider something called balloon angioplasty. So in balloon angioplasty, the doctors will locate the area of the blockade, and that can be done using ultrasound and with radioactive dyes. And once the area of blockade is located, they will insert a catheter. Right? So let me try to draw this out for you. So there is the blocked partially blocked area, and so they would stick in a catheter. Right? This is usually fed through your femoral artery, and then guided by ultrasound, it would get to the location of the blockade. Then they would inflate a balloon. Okay, the tip of the catheter is a balloon. They would inflate a balloon, and then the balloon is going to flatten this plaque. Okay, so when they pull the balloon out, the plaque is going to be flattened, and you're going to reopen this. So this doesn't really permanently fix the solution. I mean, it kind of extends the lifetime of the vessel, but it doesn't fix it permanently, because if there is a rough patch that's remaining here, then the blood clot can come back, and in a lot of people, right, they experience restenosis, re-narrowing. So to prevent that from happening, they sometimes would leave in like a medical stent to prop the blood vessels open, so it doesn't really close back. So that's balloon angioplasty for partially blocked coronary arteries. If you have a completely blocked coronary artery, that could be quite bad. It depends on where it happens. Okay, if it happens like at the end here, like there and there, then maybe it's okay, because then you are not affecting a huge area. It still affects your heart function a little bit, but it's not going to be a huge problem. Okay, in fact, it's normal to have the ends kind of blocked as you age. But if you have a blocked coronary arteries like here, then that could be a big problem, because everything downstream of that blocked area is going to be affected, right? So that could lead to a heart attack, and the medical term for heart attack is myocardial infarction. Infarction is basically death, and here we have the death of the heart tissue. That's basically what it means, heart muscles, right? So to fix that, you might have to do a coronary bypass. Okay, coronary bypass. So in a coronary bypass surgery, the surgeon would take a vessel from another part of the body, usually from the leg, and then they would create a detour for the blood to flow around the blocked area. So if this area is blocked, then the graft will hook up from the aorta directly to downstream of the block, and that would restore circulation. So that is coronary bypass for completely blocked coronary artery. Whereas if you have if you have a partially blocked blood vessel, then you will be doing balloon angioplasty. So that's the end of the of lecture 1. Please do the study guide. I will be posting the solutions to that later on. Thank you for watching.